The OU Health Sciences Center, one of only 4 comprehensive academic health centers in the nation, home to 7 professional colleges, serving more than 4,000 students in more than 70 undergraduate and graduate degree programs. And now, home to a unique project that unites students across disciplines to enhance their education, advance care, and empower patients. It's called EPIC, Empowering Patients Through Interprofessional Collaboration, a project driven by the vision of Dr. Peggy Wisdom with funding from the Wisdom Family Foundation.
She saw that there was so much more to providing care for the patient than providing them with the medications they needed, the referrals they needed. It was far more complex than that, and it required a far more complex healthcare system.
I had kind of an idea that I wanted to have an interprofessional type project, but this is truly amazing because it's interprofessional on the level of the faculty, it's interprofessional on the level of the students, and it's interprofessional because the patients are the core part of our team.
A group of committed faculty and administrators from the colleges of medicine, nursing, pharmacy, public health, allied health, social work, and dentistry work to create interprofessional learning opportunities, allowing students to work in teams similar to the healthcare teams in which they will work during clinical practice. Students have embraced the project from the start.
All I really knew about the program was that it was based on interdisciplinary team care, and I had read that that was basically the future of primary care. So I was like, hey, I want in on this. I want to be a part of that.
Throughout my career at the College of Pharmacy, I was wanting to be part of something that got all the students from all the disciplines together to collaborate in serving the patients in our community.
We deal with other professionals all the time, often without really understanding the scope of their practice. And how we can work together to improve outcomes for patients. And so this was an opportunity to work with budding professionals from all disciplines so that I could better understand what we can provide for patients and ultimately, I think, have a better knowledge of how to meet patients' needs.
Communication and team-building activities are a primary focus of students' first semester with EPIC, helping form the foundation for quality interprofessional care.
Because all of us were coming from different backgrounds and had different ideals about how to take care of patients, and we were so focused on our perspective. So learning how to communicate with each other was key, and those activities that we did seemed to build on that, teach us how to communicate.
Ultimately, the goal of this is to provide safer care for our patients. And if we can improve the communication that occurs between providers in the team, then we're going to improve safety for our patients.
EPIC helps participants gain new insights on their role in healthcare and a new perspective on the roles of other professionals involved in patient care too.
I learned so much from the other disciplines and what they do in their daily jobs. I didn't know a dental hygienist did head and neck screening for cancer. And I was like, wow, I was really impressed.
It was very eye-opening because I didn't know how involved speech pathology was in patient care or how involved, I had an idea that occupational therapy and physical therapists, and I had an idea about PAs, but nutrition, the dietitians, those different areas, I had no idea the information they could bring to the table. So that was very eye-opening.
Student interdisciplinary teams also gained very real experience through EPIC as they worked together caring for patients at the Good Shepherd Clinic in Oklahoma City.
It was more than I expected. I expected a team of people to be working with each other. Obviously, the mechanical part of it, but I didn't expect it to go so well. I really didn't. I was surprised by that.
I never felt that when I walked in the door I would expect anything less than superior care from any of my teammates. I had complete confidence in each of them.
There's no hierarchy of who's more superior than the other, or we're just an underling or whatnot. It's we're all equal. We're out to serve our patients.
I think having a common ground with people from other professions allows you to work more closely and to greater effect than you would have if you didn't get this training.
in addition to better understanding the perspective and capabilities of other professionals on the team, as well as improving team interactions and efforts on behalf of patients. EPIC strives to improve participants' understanding of the patient's role in achieving optimum health outcomes.
Understanding that in healthcare we often are asking patients to do things that they may or may not be capable of or may not have the resources to actually to do. And so we spent a lot of time teaching the students that they need to understand the patients beyond just the acute medical problem that they come into a clinic for. They need to understand the context, their social circumstances, the other things in their life that actually impact their ability not only to do what we ask them to do as patients, but also to achieve health.
This goes to looking at the whole patient in their environment and what the patient, not only what the patient needs, but what the patient is able to do and what the patient really wants to do. It is that complex, but it is focusing on the patient, and it is focusing on what their goals are and bringing all of those disciplines together to help them achieve those goals.
It really made me think that as a pharmacist, you don't just throw the medications over the counter, but you have to take the time and teach the patients, because really when you tell a patient use your inhaler 2 puffs every 4 hours as needed, they might not be using the inhaler appropriately. And so by teaching them how to use it when it is an emergency situation, they do use the inhaler appropriately and can save their life.
It is that sort of awareness that ultimately leads to better healthcare providers, better healthcare, and better health for Oklahomans. Now that's EPIC.
I think our challenge going forward is figuring out how we scale up this pilot program to the much broader campus, the body of students that we have on this very large Health Sciences Center campus.
That is a wonderful experience, and it's once in a lifetime.
For the benefit of the students, this really should be a required experience. It was probably the most valuable educational experience I had in my whole medical training so far.